The Culture Experience. The Culture Experience.
You're listening to The Culture Experience with Mel Bruce. I'm Mel Tiller, your host. I am thrilled to be with you today. Ladies and gentlemen, I have a very special guest. You might want to get some pen and paper because he's going to give you some information that literally might be life changing. His name is Darren Grubb. He's the spokesperson for Medicare Advantage Majority. Darren, welcome to the show.
Mel, great to be with you, my friend. Big fan of your show and glad to be with you today.
Well, thanks for joining us. Let's jump right in. Listen, many people have heard of the phrase Medicare Advantage. We've seen the commercials on TV. We've seen all the ads. A lot of people don't know exactly what it is. Please explain to our listeners in plain language, what is Medicare Advantage?
So, Mel, when you turn 65 as a senior, you have your choice between traditional Medicare or Medicare Advantage. Now, Medicare Advantage has been around for about 25 years or so. It is a public-private partnership between the federal government and the private sector to create competition, to create environments where patients get better care, bundled into different plans and programs, often at a lower cost. And so the appeal of Medicare Advantage is that it provides comprehensive, affordable, and quality care that goes beyond traditional fee-for-service Medicare. When I say fee-for-service, it's exactly what it sounds like. Every time you need a service or a supplemental benefit on Medicare, you have to pay a fee. Medicare Advantage is different in that it includes benefits like dental coverage, vision coverage, hearing coverage, in-home care, prescription drug coverage, that Medicare Part D that you hear a lot about. And importantly, Mel, Medicare Advantage plans include a cap on out-of-pocket costs, which is really important for seniors on fixed incomes because they know that if they have an unexpected medical event throughout the course of the year, they know exactly what their maximum out-of-pocket spend will be to meet their needs, and the program covers the rest. And so now that's important because it gives seniors financial peace of mind, especially during these high inflationary times that we're still in, where everything costs a lot more, and seniors are focused on paying for their health care. And so Medicare Advantage provides some protections for seniors, as well as bundling all of the supplemental benefits of across the Medicare spectrum into one offering.
Okay, so data tells us that more than half of Medicare recipients are choosing the Medicare Advantage plan. Why are so many people choosing this route?
You know, I think people appreciate the fact that Medicare Advantage is affordable. It bundles all of the essential things that they need to stay on top of their health and their well-being, to stay proactive and to get that preventative care and see their doctors and make sure that anything that they are dealing with is managed and cared for over the course of the year and of course the course of their lifetimes. And you mentioned 35 million. There's 35 million seniors around the country who have chosen Medicare Advantage. In Nevada alone, 317,000 of your seniors have chosen Medicare Advantage. That's 52% of your population who are eligible for Medicare Advantage. So that's on track with national trends. So we believe that the affordability is important. It provides most Medicare plans include the ability to have one point of contact, and so it's easy to get from to your primary care physician to any specialist that you need for your care, and so it just surrounds you with support, and that's why we believe that it is the preferred choice of more than half the seniors across the country.
So your company, Medicare Advantage Majority, says that you're fighting to protect and strengthen the Medicare Advantage program. So from your point of view, what major threats are coming at this plan from Washington?
That's a great question. That's exactly what we focus on in our coalition. We don't represent any one provider or agency or insurer. We represent what we call the caregiving ecosystem. So we represent the beneficiaries, those seniors who are on Medicare Advantage, their caregivers, their healthcare providers, community leaders, everyone who has a role in caring for seniors on the Medicare Advantage program. That's who we represent. We want to make sure that seniors and their caregivers have a voice in Washington, D.C. D.C. because we know that what happens in Washington, D.C. trickles down pretty quickly to Las Vegas or Reno or Minden or Gardnerville, Nevada, right?
Yes.
And so we're focused on making sure that seniors have their voices heard over issues concerning how to fund this program going forward. There have been some threats to this program, the Medicare Advantage program, in recent years during last year's beautiful bill, budget reconciliation plan. So Medicare Advantage was on the table to be potentially cut, as we saw what happened with Medicaid and other government programs. And our seniors, our coalition got very active. They reached out to members of Congress through texts and emails and showing up at town halls and telling their stories to local media to make their voices heard. And ultimately, Congress made the right decision and took that off the table. And so, potential cuts to the Medicare Advantage program have a huge impact, not only on seniors' health care, but on their bottom lines. Because when this program is cut, benefits go away. Seniors absorb more costs. They have higher premiums, higher deductibles, higher out-of-pocket costs, and they have less access to the doctors and services that they need. It adds upwards of $3,000 a year to their budget, which most seniors on the Medicare Advantage program have incomes of $25,000 a year or less. So they're on fixed incomes. And if you think about what seniors are spending their money on, healthcare, taking care of themselves is probably their number one priority, right?
Yeah.
So this is the focus of our organization is to educate and empower seniors to keep them active and involved and to make sure that they know that we've got a coalition representing them in Washington to stand up and protect the Medicare Advantage program.
Where do you think you are in the fight? Are you winning? Are you losing? Are you holding your own? Exactly where are you?
I think we're absolutely holding our own. This is something we focus on, not just one part of the year during open enrollment. This is a year-round issue for us, and so we know that we are fighting for seniors, especially in this important midterm election year coming up, where affordability is going to be a huge concern. We know that we're in a high inflationary cost environment right now. Seniors believe 91. We did a poll earlier this year, a survey of our seniors on Medicare Advantage. We found that 91% believe that funding for the Medicare Advantage program is not a healthcare issue, it's a cost of living issue. Affordability is going to be on the ballot this year. Seniors are very attuned to this. They are feeling it in their daily lives. Cost of gas, cost of groceries, cost of everything is going up. And again, healthcare is their primary concern. And so, seniors are very active, they're very political. They're easy to get motivated and engaged behind an issue, and we believe that this midterm seniors are going to be supporting candidates and elected officials who are strong on protecting the Medicare Advantage program.
Things are happening around the country. Mayo Clinic announced that it will be out of network for most individual Medicare Advantage plans from United Healthcare and Humana starting in 2026. In California, Scripps Health in San Diego dropped its Medicare Advantage contract. In Nevada, Carson Tahoe Health is said to be planning to drop United Healthcare Medicare Advantage. How stable are Medicare Advantage provider networks right now? And when people ask this question, will my doctor take my plan next year? Where are we with this?
Yeah, this is an issue we're paying attention to. We are an organization dedicated to preserving and protecting the Medicare Advantage plan and the program as a whole, which we know is working for beneficiaries and their families today. We know that things are different state to state. Things vary state to state. They vary plan to plan. And again, we don't represent any one plan, any one provider. We're representing the caregivers and the beneficiaries and those who surround seniors in their golden years. And so, this is something that we do as an organization. Another part of our remit is to make sure that seniors are educated about the choices that they have. We want seniors to do what they do when they're making big decisions, which is to talk to their doctors, talk to their families, talk to their friends who have, maybe they're a few years older and have been through this decision process before, but to understand what the offerings are and the options are in the market where they live. Choice, I would say a hallmark of the entire Medicare program is choice. When you turn 65, you have a choice in which to choose either Medicare, traditional Medicare, or Medicare Advantage. And then every year during open enrollment, you can either re-enroll in your current plan or you can make a change. You can go from a Medicare plan to a Medicare Advantage plan or vice versa. It really depends on kind of your situation and your needs. We believe that the peace of mind that Medicare Advantage provides and the comprehensive coverage at an affordable rate with all the benefits that I mentioned that are normally bundled into plans is the preferred choice because it just gives seniors so much more flexibility in knowing that their needs are going to be met when it comes to their health care.
Medicare Advantage Majority. People are listening to you. They want to be able to contact you. They want to talk to you about your company. How do they get in touch with you?
We encourage people to go to our website, which is MedicareAdvantageMajority.org. You can learn more about our organization. You can learn more about the issue. You can learn how to get involved. Mel, as you know, this is all politics are local. And
yes.
As we go into a midterm election year where seniors are going to have a big role and they're going to have a big say in the outcome of these elections, I'll tell you this, in 2024, more than 40 million American seniors turned out to vote. That was the highest turnout of any age group in the country. And so again, the president knows this, his team knows this. President Trump's pollster, Tony Fabrizio, has called seniors the deciders for their ability to move an election when they get rallied up behind an issue. And again, we believe that healthcare is an affordability issue. Affordability is going to be on the ballot this year. And so we know that seniors are going to support candidates and elected officials who are strong on standing up for seniors and for protecting the Medicare Advantage program. So we encourage people to go to our website. You can learn how to get involved. We make it easy for you. Click a button. You can send a note to your own member of Congress to make your voice heard.
Listen, I always want to give you an opportunity to pat yourself on the back. What separates your company from other Medicare Advantage companies?
So as an organization, we are a nonpartisan, nonprofit organization. Hundreds of thousands of advocates nationwide, including many Nevadans who have signed up to join our coalition to make sure that we are speaking with one voice, making sure that policymakers in Washington, D.C. know that whatever they do in Washington will be recognized as having a direct impact on the lives of their constituents all across the country. And so I think the fact that we are focused on the caregiving ecosystem, not only the seniors and the beneficiaries, but the caregivers, the spouse or the child or even the grandchild of a senior who is on Medicare Advantage. We're all involved in protecting and making sure that seniors are getting what they need. We believe that it takes a village to raise a child and to care for a senior. And I'm a good example of that. I'm a member of the sandwich generation. I'm 51 years old. My wife and I have young kids at home. But we also have aging parents and aging family members who need more care than they did even a few years ago. And so we're becoming more responsible for their care too. And the Medicare Advantage program has been a huge benefit for us because we know the consistency and the stability that it provides when it comes to the choices our seniors in our lives have to make regarding their health care. So as we're managing doctor's appointments or managing medications, making sure they've got all their paperwork filled out, Medicare Advantage provides a way to do that in a much more consistent and easy way.
So Medicare Advantage has a very high enrollment among Black and Latino seniors and among people with chronic conditions. Yeah. What does Medicare Advantage do very, very well, and where are you having some problems?
It's a great program, and it's the choice of those who have multiple chronic conditions, whether it's diabetes or heart disease or COPD or high blood pressure, whatever it may be, because a hallmark of the Medicare Advantage program is to get on top and stay on top of those issues before they become problematic. And so, again, if you're addressing those chronic conditions, you're going to need to be talking and seeing your primary physician regularly. You'll be needing to see your specialist regularly. The fact that Medicare Advantage provides kind of a comprehensive surrounding way to get all of that in one place is a huge part of the access that Medicare Advantage provides. Again, cuts to the Medicare Advantage program, to the funding for the program, will undoubtedly reduce some of those benefits, and seniors are going to have higher costs. And so that's the potential threat to the benefits of that. But you're right. Seniors choose this. People with disabilities choose this. I mentioned that the average income of seniors on Medicare Advantage is less than $25,000 a year. And so, seniors are, they want peace of mind. They want stability in their retirement years. They want to age gracefully and independently and on their own terms. And We believe that Medicare Advantage provides a mechanism for them to do that and not to have to worry about their health care. I'll say one more thing. This is a program, Medicare is a program, Medicare Advantage is a program that seniors pay into their entire lives. Every paycheck there's a withholding a deduction for Medicare for the current generation, and then you expect that when you turn 65 that those benefits are going to be there for you. And so we are an organization focused on the here and now, but also looking to the pipeline. Those who are several years away from turning 65, the guys like me. I like to make the joke, Mel, that I was 35 years old yesterday, and today I'm 50, and I'm going to be 65 before I know it. And so these are things that this is a program we want to be strong, stable, well-funded, and protected by our leaders in Washington now and far into the future.
So we're seeing more telehealth, remote monitoring, and even AI tools being baked into Medicare Advantage benefits. So from your vantage point, which innovations are actually improving outcomes and which ones are just kind of buzzwords?
Yeah. It's these are the early innings of AI, and things are moving so fast and so rapidly.
Yes, they are.
Things are changing every day. I don't think we understand the full impact of how AI and these new technologies are going to shape and help the healthcare provisions that our seniors deserve. That's one of our focus is to make sure that we remember the human element of this. At the end of the day, this is between doctors and their patients, and between caregivers and their seniors, and the community that surrounds them. And so we're focused on the human element as well. There's a policy element to this because, again, I'll say it one more time, everything that happens in Washington, D.C. trickles down pretty quick to Nevada, to Texas, to Kentucky, wherever you are. These decisions matter and they radiate quickly. And so we're focused on making sure that philosophically, members of Congress, elected officials understand the importance of a program like Medicare Advantage in the lives of their constituents and the people they are elected to serve.
So for those people who will be eligible for Medicare soon, what should they be looking at, and what should they do right now to make sure that they move into this smoothly?
And I said this a moment ago, but I think it's worth repeating. The fact that seniors have choice in terms of what Medicare plan that they choose is important. So they've got the opportunity in the year or two before they turn 65 to really do their research and again talk to your friends who may be a few years older. Talk to your doctors. You've got a pretty good sense of your own health condition, but go talk to your doctor and make sure that there's not something you're missing. Another element of the Medicare Advantage program is kind of wellness activities and preventative care, and again, just staying on top of the little things so that they don't become big things down the road. That's another element of the program that over the long run saves taxpayers a lot of money, and it serves beneficiaries quite well because if you're on top of your COPD or your high blood pressure and you're taking care of that in real time, that's going to lessen the chances that you end up in the hospital a few years down the road. And so a lot of this is on just seniors to understand what their options are within their market, within their region, the plans offered and the like, and then just make the best choice for your situation at the current moment.
Darren, I want to thank you for joining the show. You gave us a lot of great information. I want to leave the last word with you. What do you want to leave our listening audience with?
This is the time to get engaged. Again, we have an important midterm election coming up. Affordability is going to be on the ballot. You have the chance to make a difference and make sure that your voice is heard when it comes to protecting and caring for our seniors. And so whether you're a senior or you're a beneficiary or a caregiver, it's important to know that you have a chance to make your voices heard with your members of Congress. They're there to represent you, and they all need to understand that.
His name is Darren Grubb, and you heard it here on the Culture Xperience. My name is Mel Tiller, and I want you to remember this. Ladies and gentlemen, celebrate the culture.
The Culture Xperience.